T. Leroy Jefferson Medical Society is a very unique organization. It's a small group with a big mission here in Palm Beach County. We're named after Dr. T. Leroy Jefferson, who was known as a bicycle doctor and used to provide rounds free of charge on his bicycle for all within the community, regardless of ability to pay. We are a very dedicated group of minority healthcare professionals who work tirelessly to improve the health and wellness of medically underserved populations.
T. Leroy Jefferson Medical Society is great. As an organization, we are committed and involved. Every year, we have hundreds and hundreds of hours of community outreach through our varying programs.
Hello, my name is Laurel Dalton. I'm the Executive Director for T. Leroy Jefferson Medical Society, and welcome. Today we will be talking about diversity in infant mental health. And with us today is Dr. Gisette Smith, clinical psychologist. She's been working with children and adults in Palm Beach County, and you've been in Palm Beach County since 2017?
Since 2017, I've been in Palm Beach County, but working in Broward County before that.
So why don't you tell us a little bit more about your practice?
Sure. So I've been practicing in Palm Beach County since 2017, and I own a private practice. I work mainly with adults, but I work also with children and families, providing clinical services. Before that, I was working in Broward County for 10 years before moving on to Palm Beach County.
Okay, well, welcome. Thank you.
Thank you.
Okay, so tell me, with the prevalence of COVID-19, what are some supports that can be given to infants going through grief due to the loss of a family member?
Mm-hmm. I think it's interesting, that question, because when we think of grief and we think of trauma, we rarely think of infants, right? We think of children, we think of adults mainly, but infants are impacted by trauma at a rate just as much as adults, and even maybe more so sometimes, just because of their age and developmental stage. Right. When we think of mental health, we rarely do think of infants. We generally think of kids and adults, but the facts are that infants are impacted by trauma at the same rate or even more sometimes than adults and younger children. And the reasons are being that their brains are developing at a very rapid pace. So when we think of infant mental health, we're talking about ages birth to 3 years old, really. So during that phase, their brains are very rapidly developing. So any kind of trauma or loss or difficulty that they experience can impact them. So what parents and caregivers can do is they can firstly just be aware of the developmental stages that the infants are in. They can make sure that they're meeting those stages. They can provide warmth, support, validation. So those are the things really that the younger children, the infants, will need in terms of loss and grief and trauma.
So how does that display? So how do you identify that in a child who can't speak or an infant who can't speak?
So we really want to pay attention to their developmental stages. So there's tons of different charts and guidance that parents can use, but basically we want to look to see, are they walking on time? Are they crawling? Are they babbling? Are they using the first words one word at a time? Are they stringing words together? So depending on their age, that's going to let us know what stage they should be in. So what we can do is look to see if they're not meeting those stages, and that can be like a red flag, the very first warning signs that something might be off. Sometimes kids are very irritable. They might be fearful of being away from parents. They might be fearful of parents. So there's just different things that we look for to see how the child is developing and if it's within that normal range.
Okay, so based on that, so if a parent notices something where their child is delayed, do they immediately go to a professional, or do they just observe and just try to watch what's going on and just try to intervene at home? What do they do first?
I think the first step would be speaking with the child's pediatrician. Pediatricians are a very great resource because they are aware of the milestones that the kids should be meeting and when and where and what the normal range is. Mm-hmm. So they're the very first step that I would say. Going to your pediatrician, making sure that you have that conversation, letting them know what your concerns are so that you can see if this is something that needs to be escalated or moved to a different agency.
All right. So what are some therapeutic techniques that can be utilized to allow infants to be able to be expressive with their limited vocabulary to allow them to address growth from trauma?
So mainly with preverbal children, and what's being used is called infant and parent psychotherapy, and it's sometimes also called child and parent psychotherapy. So basically what it is, it's a modality that uses the child and also the parent together. So it's a conjoint therapy session where the child is basically playing and the parents are observing them, and the clinician is there as well, helping the parents observe developmentally and emotionally what might be going on with their child, and kind of giving some feedback and reflections to the parent to help them connect and understand what's going on.
Okay, I think I've seen that before.
So, but also, I don't want to fail to mention play therapy, because play therapy is another modality that's used often, and that one is usually the child only, and it looks like they're just playing, but the clinician is really kind of observing. They're observing what types of toys they're playing with, how the child resolves conflict with the toys that they're playing with. So they're using that instance to kind of observe the child and then teach them different ways to kind of cope with difficulties that they might be having in their life.
Okay, so they're intervening while they're watching what's going on.
Absolutely.
So pandemic or not, many infants go through type 1 and type 2 trauma. Can you tell me which trauma is easier to address, if any? And can you describe some type 1 and type 2 traumas that infants can go through and what parents should be aware of?
Okay. So type 1 and type 2 traumas, they're often also known as like single event trauma and complex trauma. So a type 2 trauma would be considered a complex trauma, and those are the types that are generally observed, during childhood years, because they're things that happen chronically. So it could be child abuse, whether it's emotional, verbal, physical, neglect, not having the things that they need, inconsistency. So those types of things that are happening chronically throughout the child, that would be considered complex trauma. Also, witnessing domestic violence. So sometimes a parent could say, we're not verbally abusive towards our child, but the child is observing, a really negative or harmful dynamic between the parents, and that could be a complex trauma as well. Mm-hmm. So when we're talking about type 1 and type 2 event traumas, we're talking really about single event things that happened that could be like an attack or something like that, or things that happen chronically that are just long-standing. When we think of complex trauma also, I would say that one would be the more difficult one to deal with, because especially during childhood. Mm-hmm. Because if you think, like we talked about before, your brain is developing rapidly. So if you're experiencing a traumatic event chronically during that time that your brain's developing, you might not be focused on doing the things or learning the things that you need to learn. You're focused on survival skills, and these are things that are happening that kids they're not even aware of it. They can't speak about it, but they're just doing it, Okay. So complex trauma can cause difficulties within relationships, just like long-standing chronic difficulties throughout life. And single event traumas, those, absolutely can still cause difficulties, and those are difficult to treat as well. But with single event traumas, with adults at least, your modality will look a little bit different. Exposure therapy is one thing that's very big with single event traumas, helping people learn to kind of cope with things rather than avoid it. But with children, we really want to go back to basic attachment styles and making sure that they feel very secure and safe. And that's how you're going to treat a complex trauma in a child.
So with these traumas, sometimes you see where the child or the adult will forget the trauma, or is that some sort of mask or something like that?
No, there's definitely, they call it disassociation. So sometimes a child or an adult, they do have a dissociative amnesia. So they forget parts of the trauma. And it's really something that your brain does almost to protect you, Oh, really? So when a person isn't ready possibly to cope, and this is mostly on the subconscious level. So they're not choosing to forget things, but when they're not ready to deal with it, their brain might just forget that it happened. So they might remember fragments of a trauma, or they might not remember at all. Okay. And sometimes a person can even experience trauma just kind of viscerally. So they don't remember exactly why they feel uncomfortable, but something in their body responds, and they're just uncomfortable or anxious and just not doing really well.
Okay, thank you. What can parents do to be more aware of infants' mental health, and when would be a good time to reach out to a professional for support to aid the infant in reaching their full potential?
I think the first thing that parents would have to do to be supportive is to really, like we talked about before, knowing what the milestones are. Because if you know what the milestones are and you're consistently meeting with your pediatrician and you notice something right away that's a little bit different, you'll be able to address it immediately with the pediatrician. But I also think parents can be aware of their own mental health, because what happens oftentimes is parents are battling with their own difficulties, whether it's anxiety and depression, and they're doing the best that they can. They really are. But the kids can pick up on the inconsistency, the tension in the household. So I think if parents can be more of their own, be more aware of their own functioning, that's how they can help their children as well.
So are there some exercises that a parent could do, like to kind of stop them if they've kind of noticed that they're like, in a bad space maybe with their child, or do they need to separate themselves? Is there something that a parent can do in the moment?
Yeah, so definitely in the moment, what they can do is almost like take an adult time out. So instead of allowing themselves to continue to to escalate, whether they're feeling frustrated or just like very anxious and tense, what they can do is just take a break. One thing that I really like, and I talk to my patients a lot about, is square breathing. And square breathing is super simple because it's something that you can do and nobody has to know that you're doing it. And basically, what you're doing is you're doing everything in fours. Taking a deep breath through your nose, 4 seconds, holding it for 4 seconds, and then releasing, and then doing that 4 times. So that's something that parents can do in the moment to kind of get themselves back to like a baseline to deal with their children, so that they're able to to present more of a calm presentation for their kids instead of feeling or showing outside what they might be feeling inside.
Yeah, that sounds amazing. Like something you could just kind of practice on your own.
Absolutely. Yep.
So, being in the mental health profession, what do you see lacking in the community to support infant mental health, or what can we do to advocate to support the most vulnerable?
You know what I was thinking about what can be done to help infants, and I was thinking that just starting in daycares, so making sure that the daycares and the staff that work there are equipped with the knowledge to help those kids. So when we talked about developmental milestones, going to your pediatrician, what if the daycare staff were very well versed in the developmental milestones? I'm sure some are, but maybe just making it more widespread and available for all staff to know this. So that's one thing that I would say could be done differently.
That's
and
super
I'm also
important. I'm sorry. That sounds extremely important, actually, because you drop your kids off and they're with, you don't know the training level necessarily of the staff. Go ahead.
Yeah, absolutely. But I was also thinking trauma-informed care. So trauma-informed care is basically assuming, like when a whole organization adopts a stance of being educated and knowledgeable about trauma and how it presents, whether it's in the children, the infant, or the parent. So if the staff is very well versed in trauma-informed care, they'd be able to treat almost all kids as if they, like using a trauma lens, so treating all kids as if they might have experienced something, just so they don't re-traumatize anybody.
That sounds really important. Do infants and of different racial backgrounds react differently to similar experiences of trauma? And what are the factors, whether racial, financial, socioeconomic status, etc., that influences an infant's reaction to trauma?
I think more than race or even socioeconomic status, what would influence their reaction is maybe prior exposure to trauma and adverse childhood experiences. So if a child has been exposed to a number of different events already, that they might be more likely to have more of a negative response to another traumatic event. So kids from different racial backgrounds don't necessarily respond differently, but it does, if they do have past traumas, they might respond differently than somebody that's never had something happen to them before.
Okay. Can you explain ACEs, adverse childhood experiences, and their impact on an infant's mental health, and what are some ways that parents can prevent ACEs?
Okay. So ACEs are adverse childhood experiences, and they're almost like, they can almost be like a complex trauma. So ACEs might be traumatic, they might not be, but they're basically just different things that are happening within a child's life that could potentially be traumatic for them. So whether it's living in an unsafe neighborhood, being exposed to domestic violence, so all of these different things, like I said, that could possibly be considered a complex trauma. are things that the children are experiencing when we talk about ACEs. What we can do to prevent those are educating the parents, providing supports to the parents, whether it's community resources, helping them find employment, safe housing. So being aware of those resources and how parents might struggle and the assistance they might need might decrease the chance that their children are exposed to ACEs.
Okay, all right, thank you. So is it true that trauma experienced as an infant has a more detrimental effect than it is experienced as an adolescent or a teenager, and why or why not?
Chronic trauma exposure during infancy can definitely have more of a long-term impact on children.
Really?
Because, so when you're thinking about it, their brains are developing so quickly. Our brains are developing throughout our lifetime, but during those very first stages, 0 to 3 years old, like we talked about with infant mental health, your brain's developing even more rapidly. So if there's some type of intervention or trauma that stunts your development, that's going to have long-term impact. So when adults experience trauma, our brains are already formed. We already have our personality formed, the way that we function, the way that we interact. That's all kind of there, but children are still developing that. So if that's stopped during their development, then it definitely will create long-term problems for them into adulthood.
All right. Well, thank you for joining us today. Before we close, is there anything else that you would like to share with providers and parents, an important message that you would like to get across?
Yes. So one thing that I would share with parents, providers, or others interested is just to remember always that infants and children experience trauma differently than adults do. So just because an adult might not view something as traumatic, an infant can and will. So that's very important for us to be aware of, like, our tone, how we're speaking to each other, how we are communicating in front of that child. And also, like I said earlier, just being aware of the developmental milestones and being aware of how attachment impacts the child in their development.
So, Dr. Gisette Smith, thank you for being with us today.
Thank you for having me.
Wonderful. So in our next segment, we'll be joined by Dr. Martine Sinitis, where we will continue to talk about diversity in infant mental health.
Hello, my name is Dr. Martine Sinatus, board-certified psychiatric mental health and family nurse practitioner, and I am excited to be here to speak to you about infant mental health and how it relates to COVID-19, dealing with the stressors of life, and building the coping skills and resiliency skills for our infant. So a little bit about me. I was born in the beautiful island of Turks and Caicos, and I was raised in Haiti. Came to the United States at 5 years of age, and I went through school here in Lake Worth and Green Acres. I graduated and I pursued my degree in nursing. In nursing, I went on and worked at JFK Hospital on the medical surgical floor and oncology floor, and I decided that I wanted to do more. I wanted to be a practitioner to help my community, and I went to my Master's of Science of Nursing program as a family nurse practitioner. I completed my studies, started working in an underserved population in Belle Glade as a primary care provider. Did that for several years and went back to school to pursue my doctorate degree in psychiatric mental health. And so here I am, Dr. Sinatus, board certified mental health and family nurse practitioner. So today we're talking about infant mental health. Our first topic of discussion is grief and how it relates to infants and how can we cope and deal with it during the COVID-19. So with infants during this COVID-19 pandemic, we want to ensure that we provide structure and nurturing environment for our infants. We want to allow them to know that we are here for them during this pandemic and that we will be their support systems. Even though infants are not able to speak or verbalize their responses, we can look at cues of their behaviors. We can see physical clues, which would be increased agitation, anxiety, their pupils may dilate, they may have increased respiration rates, They may exhibit behaviors that are completely different from behaviors that they've had before. These are some of the cues that we would look for. Trust-based interventions are most useful in helping infants deal with trauma. For example, helping the infant to know that you are there for them, providing an environment of safety are some techniques that can be used. Also, integrating nurture groups, social skills groups are also techniques that can be used. When we speak of type 1 trauma, we refer to a trauma that happens in one incident. For example, a natural disaster, an incident of one occurrence. A type 2 trauma would be a chronic experience of trauma. For example, chronic sexual abuse, chronic physical abuse, chronic mental, emotional abuse. So, with children who have experienced type 1 trauma, it's easier to address in the sense that it is a one-time occurrence, and there are evidence-based practices that we can implement, such as EMDR and etc. Type 2 trauma is more complex, and individualized therapies are required. Parents can nurture infants who have gone through trauma by promoting a structured environment, including safety for them and allowing them to know that whatever trauma they've experienced, they aren't going to go through them again. For example, if the child was neglected, the parent can ensure that the child will always have somebody there providing for their basic needs, such as food, shelter. An example would be to constantly have a snack for the child present, to ensure that this is their home, providing that nice, warm, filled, loving home for them can help them also. There are many things parents can do to be more aware of an infant's mental health. As the child's brain is growing, they are learning new behaviors every day. So as a parent, you have to take the time to monitor and watch for clues and changes in their behavior. Sudden change would indicate that there is something going on, whether it's distressing or it's a new behavior. So as a parent, watching for cues and sudden changes in behavior, watching for anxiety, distressing moments, can help us to identify changes in behavior. A good time for a parent to reach out for professional help is when you realize that you can no longer provide care for your child, or the child themselves are in distress. There's a lot of anxiety. They have change in behavior. They're not eating. They're not socializing. They're withdrawing from society. That's when you know definitely you need to reach out for help. Being in the mental health profession, I believe there needs to be more awareness for mental health for infants, and also interventions within different systems, especially in the primary care system, to adequately screen for mental health problems, and also more prevention programs should be implemented. Screenings and interventions in primary care, questionnaires, things, cues to look for, questionnaires for parents, programs within the schools can be implemented, education and training for the teachers, or integration with licensed professionals within the school systems that would assist. I believe schools and daycare facilities should implement programs to address trauma in children. There are some local schools which I've seen have licensed professionals in the school integrated to help with trauma and children who are experiencing mental illness. However, this should be a statewide, if not just statewide, a national implementation and program for our infants. We are quite aware that an infant's environment, their upbringing, and their genetics can influence their mental health. So in a situation, if you have a child who's raised in a very affluent community environment with a family, they have all the necessary resources that they need to grow and explore and develop. Their brains, science and research has proven their brains are larger and they often do better versus a child who's grown up in a very low socioeconomic environment where they haven't had, time to explore and experience things. So we know that the brain is rapidly growing from birth throughout infancy, children, and adolescent years. However, between the ages of birth to 3 years old, there are different neurons and pathways in the brain that are rapidly growing. So those ages are at the utmost important time where we have to stimulate them, we have to allow them to explore, we have to provide the necessary resources and environments for them to thrive. So if they're in a situation where they don't have adequate nutrition, they're not drinking plenty of water, we'll see behavioral changes, we'll see a lot of psychological changes within the child later on in life. Adverse childhood experiences can affect a child's mental health. However, research has proven if there is adequate support during these times, it can change the trajectory of their mental health. For example, if a child has experienced divorce in the home, abuse, neglect, or if a family member has been incarcerated, we know that these can adversely affect them later on in life. So some ways parents can help prevent adverse childhood experiences is providing that structure. If there's an activity that you do every day at the same time, whether it's meeting around the family home table, reading the scriptures, studying together, that's one of the interventions that a parent can take to help. So providing structure and a nurturing environment and stability for the child would help prevent adverse child experiences. So we know the brain of the child is rapidly growing as an infant from birth to 3 years old. There's pathways in the brain that are formed and connected in those early years. So that's why their brain is like a sponge. So everything they see, everything they do, they grab onto it and they hold onto it. So structure and repetition is very important at this age so that they don't forget. Now imagine if it's constant abuse or constant emotional, physical abuse that they're experiencing, that becomes traumatic and that's what they remember. So as an adult, they react differently to things. And sometimes we don't understand why a teenager or an adult acts a certain way or reacts a certain way. And it all goes down to how they were raised and who they are and how they were brought up. So a lot of times there's so much stigma associated with mental health, but yet we don't take the time to look at the roots of it. And understanding this key stage in life and being able to intervene early at their lives, making an awareness about mental health is very important. So as parents, there are things that we can do to help our children grow and to help with their mental health. So we want nothing but good for our children, but being equipped with the necessary resources and the necessary tools to help our children is very important. Knowing that the brain is rapidly growing in the early infancy years is of utmost importance. Allowing the child to explore, touch things, ask questions is very important. Repetition of these activities is important also because they remember that way. Learning new languages is also formed at this stage. So any new language that they can acquire or learn, this is the exact stage for them. So when it comes to mental health and how we can prevent adverse childhood experiences, providing a structure, loving, nurturing home is very important. Allowing the child to feel safe, nurturing them, cuddling them, holding them in our arms, providing for their basic needs all of the time, changing their diapers, making sure they have food, water, lots of hydration, because it's been shown kids that do not have enough water and hydration are more apt to be violent in behavior. So exercising is also important because it allows the child to vent and be able to express themselves. There's different types of expressions. If the child cannot adequately express themselves, they will internalize it and keep it within themselves. And what does that cause? Anxiety, stress, and distress. So they have to have an outlet. They have to be able to play. That's another thing. A parent can engage with their child playfully. It's very important for them. So whatever happens in the early years of a child's life impacts their lives later on. And then a way for us parents to help and assist our children to grow and develop is to show them love, show them that nurturing spirit, provide a loving home, provide for their basic necessities. Sometimes we have children, whether you're a foster parent or adoptive parent, we can't change what happened in the past, but we can stand in the gap and provide that loving, caring, trusting, predictability, structured environment for them.
Hi, I'm Dr. Patricia Sharon. I'm a board-certified pediatric cardiologist and a board-certified pediatrician. Today, we'll be talking about infant mental health issues. By infant, I want to define a child 2 years of age or younger. This is a specific group of individuals that really haven't been studied in terms of trauma, in terms of adverse events affecting their lives. We need now to look at this because it's the start of the new being, the person affected by mental health issues as an older child. We have some questions that have been given to us to answer. So we'll start with question number 1. We're asking today what types of support can be given to an infant who's lost a family member, an infant who is grieving, even though they can't verbalize their grief. Infants actually don't remember much under 2.5 years of age. Numerous studies find that that is the earliest age of memory. So a young child will intend to react when there's a loss of a family member. How do they react? Poor feeding, poor sleeping, waking up after only brief periods of sleep, incessant crying, failure to attain a relationship with other caregivers, not looking the caregiver in the eye, looking away, pulling away, withdrawing. Those items should be looked for when a significant nurturer has disappeared from the life of an infant. Infants actually are born with innate shall we say, behaviors. One is a startle behavior. They push their arms out and their legs out, and they bring them back in a slow-moving behavior. This is a typical newborn behavior, and if it's missing, we should think about the neurologic status of the infant. Infants have other types of behaviors, like we call it the sort of breastfeeding behavior. You tickle the right cheek of the infant, and they turn their head to the right, and they start sort of mouthing as if they're nibbling. And you can then tickle the left cheek, and the infant turns to the left and begins nursing movements with his mouth. Other behaviors are just flexor tone, increased flexor tone. So infants are inbred with things. And one thing is that they don't remember as a young infant. Nurturing really starts at birth. The infant looks for the eye of an individual, a nurturer. Studies have shown that if you look at the very newborn in the eye and you turn your eyes to the left, the infant will follow you, turning his eyes to the left. If you turn your eyes back midline, they turn back midline, and then they'll turn their eyes to the right. So there are behaviors that they have that aren't verbalizations, but they're normal, And when we have loss of those behaviors, we are concerned about the infant. With the onset of COVID-19, unfortunately, we saw a dramatic increase in domestic violence. In homes, spouses who had no further outlet were taking out negative energy on each other. It seems that when spouses or domestic partners were going to work, there was an outlet, a social outlet, and there was some stability because there was income coming into the house. When that was withdrawn, anger increased. There were no outlets because we were literally locked at home, so violence increased. Yelling increased, and infants had to observe those things. Again, how did they respond? Withdrawal, poor feeding, crying a lot, interrupted sleeping behavior. Sometimes they'll stay up all night and sleep all day, and that's very disturbing because the parents are like up all night. Sometimes these behaviors are considered annoying to the parents, and some of the violence or verbal abuse is taken out on the infant. So this is a time of concern. This is something that we really should think about and look for when we're examining the infant and wondering about something that we call in pediatrics failure to thrive. What can we do as providers, as parents, as nurturers, meaning guardians, to help the infant express with their limited behavior, their limited ability to talk? Well, there are some important techniques that you can use. Nurturing, again, is super important. Eye contact, that special look, the continuous looking for a smile and a giggle from the infant, a little cooing. Cuddling is important. In some societies, cuddling's always done. The infant is placed on the back of the mother and wrapped in a blanket, and that baby is with the mother all day. You know, how really nurturing, how really the infant feels real connectivity to the mother. That's an important aspect when there's been trauma or loss or movement in the home. Sometimes families had to move, and that's disturbing. One thing we use in the nursery, especially with prematures and newborns, is music therapy. Music therapy can be usually lullabies, Brahms lullabies, Beethoven's music. It can be something rather joyful. This helps with music therapy helps with infants who have experienced trauma. It's soothing. A soothing touch also helps the infant. A back massage, a tiny little back massage, or using soothing tools like a lightweight toothbrush can help an infant calm down and feel comforted. We have a question about type 1 and type 2 trauma and how infants sense this and which is easiest for the infant to resolve. Well, type 1 and type 2 trauma happen to infants. And unfortunately, I have to tell you that type 1 trauma, a type of trauma that's a one-time event, but it's a life-shaking, shattering event, can happen to an infant. Infants are very delicate beings. And a type 1 trauma may be enough to maim the infant or kill the infant. Things such as hitting the infant. I've seen cerebral bleeding. I've seen punching the infant, broken tracheas. How can you help an infant through that? Severe medical care. But I think one of the most important things that we do as clinicians is when we see that type of trauma, we have to move into the home. We call social workers. We call the DCF. We ask them to come in, look at the home, and real important, there are frequently other older children in the home, and we resolve these problems. It seems that while we're evaluating what's going on in the home, the infant is taken from the home. So there you are with type 1 trauma, something sudden that happens to the infant, a burn. How do we resolve that? We take the baby from the family and we put them in a nurturing environment. That's all you can do. A type 2 trauma refers to repetitive trauma, and that's probably the hardest for us to see unless the infant comes in with, as we mentioned before, failure to thrive, poor weight gain, infant not developing its milestones. At 7 months, we see the infant starting to tripod and sit on its own. If the infant's missing those milestones and we can find nothing else, failure to thrive, we wonder about what's going on in the home. For an infant, just putting the infant in bed all day, propping a bottle, we don't think of that as abuse, but that is, in a sense, mental abuse. They really depend upon us and our eyes and our smile to keep them going, to make them feel wanted. And I think failure to thrive is one key that's missing. And we can tell the parent about that. We can tell them about propping the bottle, holding the baby, how important it is. Some parents may not know. Some parents are too young to know. So as a community, we can step in and show what development and nurturing is and help that parent improve their care of their infant. So type 2 or prolonged trauma, I think there's ways that we can help out of that unless we find that there are other comorbidities in the home, such as drug abuse, mental illness, those things that we have the Department of Children and Families address. What can we do to support our most vulnerable infants who are experiencing trauma or involved in loss of a guardian or are experiencing some type of moving out of the home and parents moving from place to place? There seems that there should be some type of special child care. There was a question about child care. Is that enough? The typical child care in the state of Florida is one trained provider to 3 infants. That's really a large infant to provider ratio for a child that's working on rebuilding trust, a child that needs to learn what nurturing is again. Probably if we had more areas where a special provider could work for a few hours a day with that type of child, a respite type situation, it would be beautiful if that type of provider could even go into the home and model these behaviors to the mother and let mother play or provider play with the child and see if there are any negative influences that they're not even aware of. Voice tones, use of negative words like nosy, stupid. We want to remove those from our vocabulary when we're working with children. I think that's what we could support the community with. Infants probably don't react differently to trauma, whether there are racial differences, but I think what matters, sort of what we've been talking about before, is how is a caregiver able to mediate those traumatic experiences. And that really depends upon socioeconomic. Is a caregiver themselves able to spend the time? Is the caregiver non-working individual who can spend that day with the infant, crawling around on the ground, playing toys with them, looking them in the eye? That makes all the difference. And that's not a socioeconomic unless that person has to work. What about a person who can afford to have a child play therapist work with their infant? Very good. That could be a financial barrier to getting the adequate help a child who's been traumatized, an infant who's been traumatized needs. Are there racial barriers? Doubt that that's a significant factor unless education, lack of higher education, and financial resources are a barrier. Infants need nurturing. They don't need expensive toys. They need food. They need it at a consistent time. They shouldn't have to cry their head off for the next bottle. They need eye contact. They need sweet, kind words, soft touches. They need a person with the time to do that. Racial, socioeconomic barriers, that shouldn't be a primary problem unless that person has to work. And then our community could provide a good caregiver for that individual and their needy infant. Dr. Nadine Burks Harris put together her experiences in her pediatric clinic in Hunters Point, San Francisco. This is a low socioeconomic area of San Francisco. She looked at over 700 cases of children and realized that the need for ADHD medications, children who were in trouble, had behavioral problems, and also children who had asthma, children who had even diabetes or obesity was another big one. Those children all came from families where there was a problem. The problem, perhaps mental illness in the caregiver, drug abuse in the caregiver, domestic violence in the home, poverty, moving from place to place. She took those events as separate events, and when she added them up, she found that 4 to 7 of those events seriously affected the life outcome of the individual child. So now again, we're talking about infants, and we're saying, do infants really perceive this is going on? They can perceive it. They perceive the negative energy in their caregiver, the lack of touch, the lack of the eye, and they become, if you will, adversely affected by them. Then we talked about trauma to the infant. If at 2 years of age, that infant doesn't establish a nurturing relationship with an individual, that eye contact, that constant caring, that infant may become a person who's, we say, disassociated, a person who has a low threshold for anger. There's a real sophisticated system that Dr. Burke Harris talks about, and those are the brain mechanisms that start your fight or flight reaction. You're in your temporal lobe, you have your amygdala, you have your hippocampus. Your amygdala really senses danger, it senses violence, it sends feedback. The hippocampus feeds into your hypothalamus, which feeds into your pituitary. Your pituitary then causes your adrenal glands to secrete cortisone. And cortisone goes into your system and it gives you this extra energy so you could run a mile that you could never have done before. You can lift things that you could have never done before. These are life-saving techniques. It'll help you outrun the bear or think quickly what to do if I'm being attacked or frightened by a bear. But suppose these events are abuse. Suppose there's an abuser in the home, a sexual abuser, a beater. That child is threatened. Those mechanisms, those neurohormonal mechanisms are elicited. The child has a lot of stress. He has a lot of adrenaline, but there's no release. But there's memory. There's memory that something dangerous is going to happen, something really dangerous happened, but the child can't let that resolve. Suppose it happens again. The child becomes even more heightened by these injuries, the perceived danger, and the child then takes that with them. And one example that was given is a child is sitting in class and his classmate neighbor turns and says something really mean, something that maybe he's heard before at home. That child will overrun his frontal cortex. He'll say, I don't care that I'm sitting in class. I am going to punch him in the nose. And that's sort of actually not that the patient is super violent. It's a response that's been evoked from previous adverse childhood experiences in the home. It could be perceived that the child is ADHD, attention deficit hyperactivity disorder. He's always acting out. simply treating it with your neural stimulants isn't the answer. The whole importance of Dr. Burke Harris's work in adverse childhood experiences was to get to the root cause, that in the home there's a problem, and the problem may be salvageable, and that child may go on and experience a better lifestyle. These adverse childhood events were associated with increased illness and even a 20-year decrease in the lifespan of the child. Now, can we take this whole scientific data and trickle it down to the infant? I'm not 100% sure that can, but we know that that child, if left with the same nurture, the same provider, the same parent, grows a little older and now perceives what's going on in the home, and it becomes that child who has what we say ACEs. There are questionnaires that pediatricians can ask in the office to get some idea of what's going on in the home and if that child's involved. Those would be just, are you being pushed or grabbed by someone 5 years older than yourself? Are you being yelled at? Are you being called depreciating names like stupid? Or, if this is going bullying, someone's constantly taking your dinner from you, an older sibling. These are adverse childhood experiences that create an older child who has health problems and emotional release problems. All right, again, we were talking about infant mental health and infant developmental. One question we looked at was, how do infants learn? How do they learn who their mother is? So there was an interesting experiment that you may have heard about by Dr. Konrad Lorenz in 1952. He looked at mother goose and geeslings. Okay, when the little geesling is born, hatched, the geesling follows the mother. Dr. Lorenz intervened. He took another set of geesling that hatched, but they never saw their mother. He interrupted that interface. He stared them down for up to 17 hours after they were born, and those geesling thought that Dr. Lorenz was their mother. They followed him everywhere, and he, of course, was now the new provider for little geeslings. So infants, nurturing is an eye contact, an emotional bond between the newborn and the mother or caregiver. Caregivers may change in the first year or two of life for various reasons, but it's around 2 years of age that infant really attains his ability to establish social relationship and see someone as a nurturer and not as a non-specific person that they can't relate to. That raises another important issue in our society. Mothers have to work. I've had to work. So after 6 weeks or 6 months, mother goes back to work and leaves the baby hopefully with a nurturing provider. How does mother continue and reestablish that relationship? You have to stay those extra hours up, making the eye contact, playing, and perhaps on the weekends, let those dishes go. Find some mommy and me time or daddy and me time to develop that relationship, because really after age 2, it's really a looser bond that you have. It's the first 2 years of life. So mothers, try to give your child that time. Carry them around. Make yourself a little sling where they're always with you. Thank you. In summary today, we've talked about infant mental health. And truly, infants do see, they perceive, they react, and they react negatively to negative environments. If I were to do anything today, I would say that nurturer, that caregiver, they should really focus on eye contact, gentleness, playing. Infants need to play. They should realize that giving the bottle is not just enough. Oh, he's crying. Here, take a bottle. What's causing the crying? Maybe the infant is bored. Maybe there's gas. Listen to the infant. Try to pay attention to what they're saying. There are different cries, for example. There's the hungry cry. There's a I'm sleepy cry. There's a frightened cry. Try to perceive what's going on. Your infant is going to become your child. It's going to become your adolescent, your teenager, and it's hopefully becoming a productive adult. And what happens in infancy can follow the child through life. Let's give our infants a better life. Let's try cuddling. Actually, I think we are not carrying infants enough in our arms. There were some infant carrying items that put the infant in front of your face all day. So they weren't just being pushed around in a buggy. Other devices, we talked about the infant on the back of the mother all day. How nurturing is that? Let's think of better ways of raising our infants into productive adults, okay? Thank you.
Hi, my name is Sadia Rahman with T. Leroy Jefferson Medical Society. Today we are talking about diversity in infant mental health. Today we have a guest speaker, Mr. Tauhid Nishad. Mr. Nishad, please tell us more about yourself.
My name is Tauhid Nishad, School Behavior Health Professional for the Palm Beach County School District. And to share with you some of the background of who I am, I have been a private tutor teaching students math, science, and various other preparation for standardized exams for the last 15 years. And after receiving my master's degree in psychology, I have been a therapist for over 5 years and have the opportunity to work with the school-age children in addressing various areas of growth in mental health, and recently started a new position as a school behavior health professional, helping parents and students accessing resources in our community while supporting them in school.
Mr. Nishad, do infants of different racial background react differently to similar experience of trauma? And what are the factors, whether racial, financial, socioeconomic status, etc., that influence an infant's reaction to trauma?
Now, trauma can be identified in various aspects when it comes to duration and frequency. When it comes to a specific type of trauma, how one reacts to that specific event does make a significant difference. For example, if a child falls off a swing in the playground and if the parents walks up to them hysterical, of course the child would project to what the parent is showing through their emotions. But by staying calm and being able to support the child through that situation may further help the individual overcome it in an appropriate manner. Now, when you're discussing trauma itself, depending on the upbringing of that child, the environmental factors, and how the individuals in their direct environment reacts in a particular situation will further hinder how the particular child able to observe that as trauma and furthermore be able to overcome it with proper coping mechanisms set forth by the guardians in that particular environment, as well as moving forward. So the answer to your question is there racial and other differences in terms of how we see trauma? Yes, most definitely, because we all have different upbringings and how we see situations from a different perspective. That perspective can further hinder how we react to our children and further hinder how each children sees the environment to be.
My next question is, pandemic or not, many infants go through type 1 and type 2 trauma. Which trauma is easier to address, and can you please describe what are some type 1 and type 2 traumas an infant go through and be aware of?
That is a very good question. First and foremost, covering what the type 1 and type 2 traumas are, a specific situation can be traumatizing to one while not to another. So type 1 trauma is usually a one incident. Type 2 trauma is over a long period of time, such as through duration and frequency. Children's mind are ever growing, and their brain is like a sponge taking up as much as information from their environment as possible. So if their goldfish has died, who they have beloved for a long period of time, they of course need to process that, and that could be type 1 trauma, easier to address. But due to the pandemic, there have been significant amount of reports of higher domestic violence, suicide, and other aspect of crises, which can further impact a child's mental health and further needs more intensive care, which would be considered more of a type 2 trauma. In addition to what has been happening with the pandemic, various situations even in schools, such as bullying or other factors, can also result to a type 2 trauma of that student or children having flashbacks, and not being able to have a healthy coping mechanisms can be harder to help them overcome it. In many cases, they're not even able to verbalize their response, and not being able to verbalize or understand what may be going on, it becomes even more harder for the professionals as well as the guardians to be able to assess and address what needs to be done to allow the individual, the children's, to be able to overcome it and build resilience to it.
My other question is, what are the therapeutic techniques can be utilized to allow infant to be able to express with limited vocabulary to allow them to be able to address the growth from trauma?
That is a very good question. And in many cases, we may not have all the right words to express our own thoughts and feelings. And we're adults, not with limited vocabulary and with unlimited emotions. But with children suffering through various crises and or trauma, not being able to verbalize it creates an extra challenge for professionals to be able to address it, as well as helping them overcome it. There's techniques such as play therapy, art therapy, allowing them to be able to draw and express, not through verbal means, but through creative means in which how they have felt. And those that have proper professional training to be able to understand various forms of drawing and what they may be going through can further create treatment options to further help them overcome it, as well as through various play therapy as well.
How can parents nurture infants who have gone through a trauma?
That's a very good question. First and foremost, the most important thing is to assess the situation. When we assess and listen non-judgmentally, we can better understand what the individual is going through. And by giving them reassurance and information, we can further assess and empathize with them as to what the children going through, and further providing support to them so they may be able to overcome it through setting healthy coping mechanisms, as well as allowing them to reach out for resources outside with multiple different agencies providing support.
Thank you for that answer. My next question is, what can parents do to more aware of infants' mental health, and when would be a good time to reach out to a professional support to aid the infants reach his or her potential?
Well, as an individual growing up in this ever-changing society, I don't have all the answers to all the questions. So does everyone else. So when a parent sees that sometimes it is difficult to address the situation or the patterns of behaviors and situations that is normal for their children is changing, it is always encouraged to be able to reach out for resources and services that are provided in our community to further help and support them. Because we are not all know-it-all. We all are learning as we go. It is okay to say, I don't know, or I am wrong. And it is okay to reach out for support. So that way, we as an individual in this ever-changing society can grow, can learn, as well as supporting our next generation and infants be able to reach their full potential, overcoming any sort of crises or trauma that may unfortunately have hurted them in any way, shape, or form.
Are schools and daycare facilities equipped to support infants who are experiencing trauma?
I cannot speak for the daycare facilities as I've not had enough experience working with them, but working in the school district, I've had the opportunity to observe how much support they have. For example, myself, I am a school behavioral health professional, and we are in pretty much majority of the schools providing supports to our children in our schools, connecting families with agencies to provide further support while making sure the children are safe. Well, there's also co-located mental health professionals also in well over 100 sites in our school district, providing intensive therapy to the students that might be going through some crises or other factors. In addition to that, there's CAPE team providing support to our district as well as the school psychologists. So when it comes to the schools, the public schools itself, they have invested time, effort, and they have gathered professional from diverse groups to be able to provide a safe environment for the children to be educated while providing mental support so they may be able to build resilience and overcome any challenges that may be coming up as the years and decades continue.
Being a mental health professional, what do you see lacking in the community to support infant mental health, or what can we advocate to support our most vulnerable?
Well, there are many different agencies that are here supporting mental health from infant to adulthood, as well as in public schools, as well as various faith-based programs. Now, the factor that is definitely lacking is more education to overcome stigma, because as the years continue, as the days continue, the stigma still exists about reaching out for support. Now, even talking about myself, sometimes I may come up to a challenge that I'm not able to address. I have a very supportive colleagues, supervisors that I can reach out to address those concerns. In your family, you could do that as well, as that is your support system. In certain cases, we may not have specific answers and we're still running into a wall or challenge. Seeking out mental health support and overcoming the stigma can allow us to get the support we may need at that particular time and overcome challenges to be best not only for ourselves and also for the infants that may be going through some crises. So to answer to your questions, yeah, majority of the support already exists in our community, but the stigma and overcoming it with a proper education and advocacy can further help others reach out for these services. And many services, even if you do not have insurance, there are multiple agencies that are providing free services to individuals that many may not even know about. And educating them in regards to who these agencies or companies are can further allow each individuals in the community have access to these services.
one last thing, Mr. Nishal, before you go. Given the last year and a half with limited social interaction, especially with the adolescent population, tell us what are some impacts and what can parents do to help them minimize these negative effects?
Well, that is a very good question. The last year and a half was very unpredictable. We did not know what was going on, and we did not have all the information at any given point. But as we progressed, being more informed, we learned so much, and we grew as a group, a community. Now, we also understood that many students not being able to go to school, not being able to do the things that they do normally, felt very isolated. Many connections were broken, socially, personally, and they were just at home looking through the computers to learn from a teacher. And in some cases, many students have said that they have lost motivation, lost focus, as well as seeing the classroom as like watching YouTube. Now, one of the easiest things a parent can do of an adolescent as well as infant to bridge that connection, have a dinner with your family, have a meal with your family, and have that conversation. During that meal, taking away technology and just conversating with them to really understand them and to better assess how they are doing, and being able to share how you are doing and empathizing with them, and eventually helping them bridge much of these connections. And especially socially, when in the fall, many students will be going back to school in bricks and mortar. And with the greater sense of anxiety and stress that already is built upon around COVID, understanding what those anxieties and stress could be, and speaking with individuals in school as well as in the community can further help them alleviate those appropriately. As well as if you are able to be around family, enjoy nature, try to find common grounds, common activities that you all enjoy together. Building that connection in the family dynamic will further help these children make social connections when they are in school, and being able to communicate their various factors with a trusted adult as they have done in the family dynamic will further allow them to overcome many aspects of social anxiety or stress, as well as being able to grow and reach their full potential.
Thank you for joining with us, Mr. Nishal. Do you have any final thoughts for our viewers?
Yes, I do. Please take care of yourself. You have gone through many challenges this year, many of which many of us may not understand. But as a caregiver, as a provider, and a professional, please take care of yourself. Even if it's for 5 minutes, get in touch with nature. We live in a beautiful state of Florida where the beaches are very close by and beautiful parks. Take 5 minutes just to distract yourself from everything around you and take care of yourself, as you will be taking care of so many.
Thank you, Mr. Nishal, for joining us today and sharing valuable knowledge to our viewers. I'm Sadia Rahman. I'll see you next time.